Okay, let's look at the low back. So neuromuscular pain syndromes, again, this is just showing you the simplicity of it. So I always like to start at the nerve. So can I have you bring this up just a little bit? There we go, thank you very much. So let's say it's low back pain. Let's say it's in the center. Where do I want to start? I always want to start at these points here about L3. Remember, goes up, and the spinal cord doesn't start till L2, then 3 comes up in the plexus. Many times when it comes over, it crosses and decussates that pain pathway. So many times you see a lot of people that come in with failed back surgeries, and lots of times they miss the level. So I want to laser these points particular here. I can have her come on her stomach. We could do it also from the other way. The nice thing with the Avant, it has lots of power, so I'm going to get that depth of penetration, but I like to do usually starting in front, resetting the pelvis, right? My first thing always, reset that pelvis. Then we can come to the back, we can work on the piriformis, we can look on the other particular areas that need it, right? You got those QLs involved, we got the piriformis involved, and away we go. Now, if we come into the hip, we're going to come into the hip areas, and we're going to laser those. And we can come into that particular area. I can have on a stand. I could come in here, work the psoas, because I know the psoas is going to be involved, and I know this TFL is going to be involved. So I can have it just on the stand so it allows my hands to be free, or I can just laser it. But I encourage you to use the stand. So if I'm using the stand, I just bring the stand in here, put it on the laser, and just put it right on that particular area and go. So while I'm lasering, I can have her bend her knee up. I can come in and work out the psoas. I can work the TFL. I continue down for the knee. You can bring your knee back down, and I can put it right on the knee. When I'm coming here, I could do some percussion work, or I could just laser the knee. It's very simple. It doesn't need to be complex. I would probably keep it here for about 4 minutes. Sometimes you need to go a little bit longer. The same continuation. I always start at the nerve root. I always reset the pelvis. And then we can come down to the foot and the ankle. If I had an Achilles problem, we would flip her back over. If I had tarsal tunnel, I could have her take her shoes off and come into here, and the plantar fasciitis. So lower extremity, we're continuing using chronic pain. We're just following the book, right? We're just following the points in the book, understanding that I'm giving you points that for nerve entrapments and for trigger points. So there are stepping off points, but she might have pinpoint pain somewhere else. Don't be afraid to go to that particular area, all right? So that's the lower extremity. Very simple, doesn't have to be complex. You can go more complex, it just depends on where you want to go. This way it's pretty easy, and then really the team can drive those and your team members. All right, thank you.